What up, guys? And girls, and everybody in between, and all that. So, my name is Marcus Mitchell. I am 16 years old currently, and I want to just go into my top surgery fund. Just go right into it and describe it and what's going to happen with it and all of that. So let's do it. I have been in touch with a surgeon down in Florida. He is pretty cool. I've seen some of his work and the results and all of that. A couple of my friends have actually gone to him. And his name is Dr. Wagoda. Yeah, I think I said that right. If not, I'm sorry. He is offering a low amount for top surgery right now. And that low amount is $5,000. Seems like a lot to me because I've never seen that type of money. I've always seen like up to like $200 and that's it. Or up to 300. Even then, like, that's special. And so usually top surgery is from 5,000 to 10,000. Like, it can range anywhere in between. It all depends on the surgeon, how popular they are, and and what kind of anesthesia they use, and I guess, and all of that. So, yeah. So Dr. Wagoda had me present my chest to him. And so I did. He was like, all right, 5,000. The surgery that I will be having is a double incision with nipple grafts. So the double incision goes basically right underneath my man boobs. And they take the excess breast tissue out to make it flat and normal. So it's cool. And the nipple graft part is when they cut you open, they take your nipple, because your chest moves down and it just moves, like your skin stretches or whatever. So they cut out your nipple, and what they do, because since usually, like, my nipple's like that big, okay? And actually, I don't really know, whatever, but let's say like your nipple was that big. What they do is they cut it they shape it to the size that looks normal enough for a guy, for a chest, for my chest, and whatever. So that's cool. And so I look normal, basically. So the $5,000 covers the surgery itself and the anesthesia, and the before and after. So the post-op, the pre-op and the post-op appointments, which is really, really, really cool. I am raising $6,000 because on top of the surgery and all of that, I need to make sure that I have a safe ride down there. I have like the recovery needs. I need to make sure that I have a place to stay down semi near where the surgeon is. The surgeon is about 4 to 6 hours away from me right now. He is in Florida. I don't remember what part, but it's like south. It's near Fort Lauderdale or in Fort Lauderdale or something like that. So the $6,000 goes to like a ride or rides. I would really like to see myself go to New Beginnings TLC in Fort Lauderdale. And that is a little pricey. I believe it's $126 per night. But that includes a whole bunch of things. So that's really cool. But I would need to stay in the area so that I can get like my bandages removed and my drains taken out. So what they do is they have a drain that goes, it's like this big. It's like the bottle type thing, and it kind of looks like a grenade, honestly. And it is attached to a tube, and the tube goes in the beginning of your incision in the armpit and runs all through your incision until here, and then the same on the other side. And that just drains the excess blood and fluids and stuff, so that it can try to prevent infection. So that's cool. The $6,000 also goes to medications that I might need, that he might prescribe, just for recovery and trying to make that process easier. So, yeah. I wanted to show you guys what a binder looks like, in case you didn't know. It is extremely constricting, and it actually can be damaging to breathing, to your ribs, to your breathing, if you don't know how to safely bind. So I'm going to show you what it is. So this is my binder. This is actually the inside. So this is what goes on my chest. And it is very, very tight. I guess you could say it's kind of like a corset. I guess. I don't really know. But it hurts to breathe. Really, honestly, like it takes a lot for me to breathe, and I already have asthma. So on top of the asthma and the weather and the binder, like, it's extremely hard. And having a flat chest and having this top surgery it's not only life-saving, because I feel like if I don't get this surgery, I'll either end up doing it myself, and this isn't like a threat or anything, like it's like legitimately like what I've thought of, and like doing it myself, or simply not existing, just solely because I feel like I'll never get it done. It'll never happen, and all that. And there are other factors that would play into life-threatening sort of thing, or not life-threatening, but a life or death sort of thing. And top surgery will absolutely save my life. Some people think that I still won't be happy with my body afterwards, and you know what? Honestly, it's normal to not be happy with your body in general. And you know, even before I came out, I was unhappy with my body. Now I'm just dysphoric all the time, pretty much. And I've become sort of like a hermit of sorts, because I'm so uncomfortable with specifically my chest. Like, not how big I am, not how I sound, like, it's specifically my chest because it's so big, to me at least. And it's hurtful. Like, I get misgendered constantly. Like, I got the binder and the misgendering kind of slowed down, but it didn't stop it. And honestly, like, I guess it'll never stop fully, but it'll stop as much as it is. It is a long thing. So that is my story. That's my binder. I don't really know what else to say, but if you please, like share if you want to help in any way. If you can't donate money, then share the link with your friends, family, anybody, and keep sharing it. Like, get the word out there. Any amount helps, even like $1, even 50 cents. I don't know what the minimum is. I think it's $1. And anything helps. Anything. I am actively saving myself. But there are also other factors in my life right now that are preventing me from saving a huge amount. Which are, I need to get my psych meds in check and all of that. But this will help so much. So yeah, sorry for the long video, but I wanted to explain what is happening and all of that. So thank you for watching, thank you for listening, and thank you for the donations ahead of time, and to everybody who's donated thus far, and thank you for sharing and all of that. So yeah, bye.